Hi friends, today we will discuss about the ECG, an essential part in the topic cardiovascular system. ECG is nothing but electrocardiogram or electrocardiograph. Coming to the principles of electrocardiography, it is nothing but the electrical depolarization which is spreading through a tissue and the current which is flowing between the neighboring regions which are polarized and unpolarized. So, this separation of charges or this difference of charge can be recorded by using the voltmeter. So, the ECG machine is nothing but it is having a machine and the chart which records with the help of voltmeter the dipole moment, and with that it will show the impressions in which the heart is beating. So, the ECG waves, as you may knowing, it has got the waves like P, Q, R, S, T wave, and this is the pattern of the ECG. So, different ECG segments are there. There is a PR segment, there is a ST segment, the ECG intervals are there, PR, QRS, QT, ST. Sometimes you get the confusion in between exactly what it is. So, let us see one by one what exactly it is. So, with the help of ECG, you can easily explain the cardiac cycle itself, the atrial depolarization, ventricle depolarization and total cardiac repolarization we can explain. So, in the P wave, it starts with the initial atrial depolarization. The PR interval represents the AV conduction time, and most of the length of PR interval is the delay in the atrioventricular node. So, if you observe in this image, observe carefully in the series, you can see in the purple color there is an impulse spreading from the SA node. So, the P wave is appearing. So, the atrial depolarization is there, and in the second image which we are showing, in that the P wave is complete and the Q wave has begun, means the atrioventricular node has started spreading the waves or the impulses to the AV bundle of His. Here the Q wave is generated. So, the PQR wave is there. So, through the Purkinje fibers it has started reaching the ventricles. So, in the PQR wave, the ventricles are almost getting the whole impulses. So, here in the PQRS segment, there is a ventricular systole and the repolarization has started, and which is represented by the T wave. It is very simple, the atrial depolarization, ventricular depolarization and the repolarization, atrial systole, ventricular systole and complete cardiac diastole. So, the whole one heartbeat is represented by one ECG. So, this is very simple. And why the ECG is taken out? So, with the non-invasive technique and very easy technique, we can easily identify the arrhythmias, the disturbance in the rhythm of the heart, the myocardial ischemia, is there any interruption in the blood circulation, is there any infection in the pericardium, pericarditis, or the chamber hypertrophy, electrolyte disturbances can cause the disturbance in the arrhythmias, or sometimes even the drug toxicity. So, what are the different abnormalities? Here I have given some examples. If the larger P value is there, obviously larger area of atrium, the larger will be the P value. Larger Q, there is a chance of myocardial infarction or the heart attack because of the interrupted blood supply to part of the tissue, and part of the tissue has become dysfunctioned. Enlarged R represents the enlarged ventricles, flattened T represents the coronary artery diseases. So, like that the many examples are given in this slide. So, you can see on the top there is a normal ECG, and down there is an ECG with the nodal rhythm where no SA node activity is there. So, if the SA node is not working in certain conditions, the AV node will take over the charge of beating of the heart. So, these are some of the abnormal ECGs. Hope you have understood the ECG and its function, and you have connected the ECG to the cardiac cycle.